Yeah, no,
No, I don't know. You discussed that a couple times and for.
started.
Okay.
All right, Dr. Wright. All right, we'll go ahead and call our meeting to order since we're right at 10:30 today. We'll start off with roll call. Shelley, do you want to do this in the roll call? Amber Rice here. Brian Smith.
Here.
Chester Keith.
Here.
Jason Johnson.
Here.
Chris Ramos. Chris Long.
Here.
Matt Shaw.
Present.
Orlando Alcordo.
Present.
Ryan Harold. Sandy Nygaard. Darren Hollingsworth.
I'm here, thank you.
Thank you. Stevie Merrill.
Present.
Troy Hoke. And we have quorum. Okay, thank you, Shelley. So moving on to item 3, which is chairman's report. So you'll notice that attached in the packet for the meeting is the attendance report. So just a reminder, if you missed 2 more consecutive meetings, we'll reach out, make sure you still want to be on the committee. And I do appreciate everyone that was able to join today, so thanks very much. Next is the vacancy report. We currently have no vacancies and have a full roster for the education committee. Number 4, moving on to the bureau report, and I'll send this one over to Chief Garcia. She had to step out over Al.
Hello.
Hi, Gail.
Hi, this is Gail. I'm going to be covering Chief Garcia's report, and I do see Chris Ramos is on the line as well for attendance. Thank you, Chris. So Chief Garcia just had to step out for another meeting, so she wanted me to give the report on her behalf. So a couple items she wanted to highlight, just that the Bureau is really monitoring workforce trends, and there is going to be a survey that is going out shortly that Julie will cover later in the Bureau report. Also a reminder that the Bureau is going to be converting to the image trend portal. We should have a report from Lihia in a little bit as well. And I wanted to send a big thank you to the Education Committee. This committee really does a large volume of work, as evidenced by some of the training curriculum we put together recently, and especially the field triage training that was put together by Drs. Rice and Munn. This has been a wonderful resource for the entire state, and really wanted to thank you on behalf of the Bureau for all the work that you put into doing these training curriculum. Next, wanted to make just an announcement. Julia Vinton, congratulations. She is now officially the new Services Section Chief. She has been in that interim role for some time, but this has now been made official, so congratulations to Julia. We do have 2 new Bureau staff that I believe may be in the room with you as well today. The first is Jim Archer, who is an enforcement investigator, as well as Sebastian Thomas, who is part of our Care Grant Program coordinator. He has been here a little longer as well. Next, I'll cover the naloxone Leave Behind program. So you will be reviewing later on the agenda, the draft training as part of the updated naloxone Leave Behind program. This is going to be hopefully approved today and will help facilitate going live with this program. As we near the completion of all the prep work, some of what we've been doing in the background is coordinating the naloxone ordering so that we can help deliver that directly to EMS agencies. And we are also working with the University of Arizona Center for Rural Health and making essentially little guides that go with each naloxone dose that are really resources for the patients. And so this is going to be very specific to the geographic area where your patient population is. So when you order the naloxone will come with a resource guide that's kind of specific to your area. As we finalize the completion of this, we will send out communication via Gov Delivery. We will also communicate out via the 4 regional councils and our other EMS listers throughout the state. Any questions on those items? All right, hearing none, is Lahia on the line?
Yes, I'm here. Good morning, Dr. Bradley.
Excellent, thank you so much. I was going to say I would butcher this portion, so I will hand it over to you to cover this part. Thank you.
Good morning, everyone. So I'll give the brief update on image trend. So Shelley, can you skip to the next slide? So there's going to be a major update on our website. If you look at the ADHS, they also made some website changes, which you'll be able to access our homepage a little bit easier. Next slide, please. So if you search for the health emergency medical care technician section, that will prompt you to our page. So next slide, Shelly. So this is going to take you to our page. You'll be able to find our new logins for our new LMS. Next slide, please. And the system is going to be mobile friendly, so you'll be able to access it from your computer, or it's going to be, like I said, user friendly for your mobile devices. Next question. So with our moving to our new system, we'll be offering more safe services in the portal, along with the EMCT certification and the ambulance registration applications. We'll also be having the certificate of necessity applications, along with the education section, the trauma-based hospital applications, and we'll have the online complaints available in the new system. And you can see in there, that's a screenshot of the applications, some of the applications that we'll have available. Next slide, please. So that's a screenshot of what the page, the landing page will look like. We'll have more information in there as far as logging in, how to access your account. If you had a previous account, if you currently have an account with the current system that we have, you'll be able to log into the system, and then we'll have steps on how to do so as well. And then we'll have steps on how to create a new account, and we'll have instructions on how to do everything else. So this is a quick video of how to create the account. Excuse me, our accounts. But before we look at the video, just some quick other updates. Our current system will be going offline March 31st, and then once we go live again, we'll be going into the new system. So we be expecting the system to go offline March 31st, and then our go live date is expected to be that weekend, the first week of April, and we'll be sending out updates regularly. So we can play the video. Yeah.
Okay. Audio.
So we'll have more videos like this showing the users how to use the system. All the staff in the Bureau has been putting a lot of time and effort into making the system as friendly as possible. The feedback that we've got is that it's a really easy system to use, but we'll have videos, and then we'll have guides to make a smooth transition. Thank you.
Thank you for that update. And this new system will really allow us to better track our current EMCT workforce in the state. Currently, we really aren't able to tell of the certified individuals who's currently working. And if people retire 1 month after they renew, we wouldn't necessarily know that information. So hopefully with the new system, we'll be able to track the EMS system much more closely. Thank you for that update. Next, if you can click on the link for item E. So I just, again, wanted to thank the Education Committee for this training curriculum. As you can see here, this is all the different training options that this committee has worked on. But you can see here, one of the biggest ones is this recent update to the national guidelines for the field triage of injured patients. And this is based on the most recent update that was done by the American College of Surgeons, the first update for field triage of injured patients in about 12 years now. So this is a significant update. This training curriculum is available in both PowerPoint as well as PDF, but also in a version that has embedded video and audio that can be uploaded directly to your learning management system. So there is the zip file that can be uploaded directly, as well as information on how to upload that if necessary. So just wanted to make sure the group was aware that this did go live, and a big thank you to the Education Committee for completing this. Next on the agenda, we have included from 911.gov the 911 annual report. This is based on 2021 data in case anyone is interested in looking at that. Next, I will hand it over to Julia regarding the EMS and trauma needs assessment and workforce survey.
Thanks, Dr. Risley. So we wanted to let everyone know that the Bureau, in partnership with the 4 regional councils, is conducting a 2023 statewide EMS and trauma needs assessment. The results of the assessment will be used to develop a statewide EMS and trauma system plan and 4 regional emergency medical services plans. Assessment will invite responses from 2 target groups, individual EMCTs and organizations, which includes EMS agencies, hospitals, training centers, and staff. Beginning today, we are able to share the link for the individual EMCT survey, which will be distributed widely. We plan to send it out via the current EMS portal as well as via GovDelivery. We invite you to participate in the assessment and share with those who might be interested in participating. If you have questions, please feel free to reach out to me. I will put a link to the survey in the chat as well as my email address if anybody has any questions or concerns about the survey.
All right, thank you. I was going to say, any questions for Julia?
I'll go ahead and put the link in the chat now.
Thank you. Next, for the EMS annual report, Shelley, if you can maybe bring that up and share the snapshot, we'll highlight that. We have a busy agenda, so we won't go through the whole EMS annual report. This is up and live on the website, so we can share the link in the chat box as well. This is the snapshot of the EMS system. You'll see here, while it is the 2022 report, this is based on 2021 data. Based on when the data comes in from the hospital system and gets linked, there is some lag time. But you can see for 2021, we had 1,231,000 EMS incidents and just over 1,100,000 that were included in the analysis. You can see our total number of active EMCT certifications at just under 22,000, as well as new EMCT certifications. As mentioned previously, we are hoping with the new image trend system that we will be able to more closely kind of track the active certifications moving forward. When you look at the actual incidents, you can see the number of incidents per day is just over 3,000. When you break down the total of ground versus air, obviously ground is a much higher percentage of our calls at just under 98%. You can see as well the breakdown between 911 and interfacility transports, and a breakdown of calls based on age. You can see that patients 0 to 17 make up just over 6% of calls, and patients over 55 years of age make up 55% of our total EMS calls. Currently for the 2021 calendar year, we have 179 agencies submitting data to AZ peers, including both ground and air providers. And in the center on the left, you can see prevalence of primary and secondary categories of interest among pediatric patients. Again, this is not necessarily the highest percentage, but more specifically categories of interest that have been brought forward. You can see that injury is 19%, respiratory distress at just over 8%, seizures, psychiatric illness, suicide attempt or completion, as well as substance use. And when you look at county-specific EMS incidents rate per 100,000, you can see La Paz County has the highest rate per 100,000 compared to the rest of the state. And we've got the medium time intervals for 911 EMS ground incidents as well. And prevalence of primary and secondary impression categories of interest, again, adults. You can see the difference. I think we've highlighted previously when you compare adult versus pediatrics. In pediatric seizures is about 6%, and in adults it's 2%. But you can kind of see those trends. And again, injury is a high percentage in both groups. And mortality by primary and secondary impression categories. cardiac arrest, just under 86%, opioid at 13, STEMIs 8%, stroke 5.5%, and diabetes 2.5. So that is a highlight and snapshot of our EMS data for the 2021 calendar year. Again, we will have the whole report available. I did see that was posted in the chat. Thank you, Kim. If anyone would like to go into more details, those were reviewed earlier this morning in top view. Next, just in case anyone is interested, we did include a link for the public comment period for ADOT's tentative 5-year construction program, proposed changes. So wanted to make that available for anyone who is interested in providing public comment for that. And that is the end of the Bureau report. Thank you.
Thank you, Dr. Bradley. Are there any questions for the Bureau on any of the items that they discussed? I'll move on to our discussion and action items. So the first is to discuss, amend, and approve the draft minutes from November 17th meeting.
I'll make that motion.
Brian? Yeah. Right, so the meeting minutes are included in your packet. After reviewing them, as well as motions to approve. No. Favor of accepting the meeting minutes as written, say aye. Aye.
Aye.
Aye.
Moving on to the next discussion and action item. We discussed, amend, and approve a draft of the FR Care grant, naloxone leave behind training. This is attachment 5B in your packet. So this training is not something that the committee has not, well, the content isn't something the committee has not seen before. So we currently have a version of much of this content on the website as a PowerPoint presentation and some other documents. What the group working on this grant has done is to create a more sort of interactive style of education similar to the trauma triage training that's now on the website. So there is a little bit more audio and video components, embedded quiz questions and things like that. The content is largely the same. I don't know if we want to scroll through the entire thing. It is, fairly long. In here, you can see that there is a pre-test included in it. Talks about the scope of the opioid pandemic with some embedded audio sections within it. Also includes some data from the ADHS opioid dashboard as well, just to provide some additional context. It continues with some more interactive content, some sort of flashcards and more quiz questions. It talks a little bit about medication-assisted treatment, education about harm reduction and what harm reduction is, and then begins to go through some information about the state of emergency and the timeline related to that. Give some statutory references related to who can administer naloxone, the naloxone leave behind guideline that was created for this as well, and then how to order the naloxone. And again, more quiz questions, and then kind of goes into recognition and how to actually administer, give step-by-step instructions on how to administer naloxone. And then follows up with a post-test at the end. So much of the content was actually taken directly from the PowerPoint presentation that currently exists, adding in some more images and audio and video, but largely the same. Are there any questions for that? But obviously be offered to any agencies that wish to institute a Leave Behind the Lockdown program, would provide them a way to administer and track their training and their learning management.
And just a comment, Amber, thank you for presenting this. When these do get uploaded to the learning management system, it's really a great resource. It's kind of a time process. There's different interactive tools throughout it. And so it really engages the provider to keep them a little bit more interested and in tune as they go through the training. It has the audio and before you can go to the next page, as well as kind of flip cards that you have to address as well. So a really great training resource and look forward to seeing more of these developed.
Any specific discussion on this current topic? Also be willing to take a motion to approve this training going up on okay, all in favor of the draft of the Leave Behind the Lockdown training? Say aye. Aye.
Aye.
Any opposed?
Aye.
Thank you. All right, motion passes. Moving on to the next discussion item is the draft training for SDR for EMT airways, supraglottic, and IGEL insertion. Matt, who put together much of the content for the group to review. For the work group, the SDR training is meant to provide a resource for agencies aimed at BLS providers, so meant to be taught at the BLS level. And we did not include instructions on how to insert the King Airways, as the work group felt that there were not really very many agencies currently using the King Airway. So this training really does just focus on IGEL insertion and troubleshooting and confirmation and those sorts of things. So it's going to kind of look through the content here. Presentation goes through essentially spends the bulk of the time on the procedure itself. And a little bit about troubleshooting. Anyone have any specific edits or other discussion on the topic? Thank you, Jason. Do I have a second? In favor for the SDR EMT? Aye.
Aye.
Abstaining?
Aye.
The next one I have on the table here is what should go in your EPCR training. This was mostly a review of existing training that has already been up on the website. And Offspring did provide some great feedback and contributed to this training currently. So through this training. There are some definitions in here. Beginning of the presentation walks through the EMS databases and the importance of data completeness. And then a little bit about where the data goes, where the data flows, what we do with national and statewide data. Talks a little bit about why it matters, and then goes through the some commonly missing items, setting us afterwards. Here's the data flow, how it goes in and out of the different databases and where they're connected. Data completeness, this slide talks about frequently missing items that are important for data completeness. So it touches on those. Entitled CO2, another frequently not documented. Provides a reminder about the importance of Entitled 2 in confirmation. And the last part here are basically summary of the different data elements for certain diseases and cell types. We will look through these again. There are probably a couple of changes with the change from version 3.4 to 3.5. And Shelley offered to help me make sure that we go through the crosswalk document and just make sure that what will be posted is accurate with respect to the new version 3.5 for the NEMSIS data element. So we'll just make sure those are correct before it's posted. And then at the end, some other important data elements. Yeah, I think we went through it and I just missed what you went through. Yeah. So that's the end of it. There weren't actually a whole lot of changes.
Approved.
Making a motion to approve as it stands?
Yes, Matt, and then Jason second.
Okay.
All right. All in favor to the minor changes made to what should go in your EPCR training, say aye.
Aye.
And are there any opposed? Thank you again for those work groups. We had great participation in these work groups, and especially the new trainings that were very well done, I think. And then for the next training related is the PACES, pediatric seizures, and epilepsy training. Do I have anyone from the PACES committee that would like to discuss this one? Great, perfect.
So this is in response to one of our members suggesting to our work groups that seizures be covered, and so we did just that. The work group has had a look at this, the PACES proper has had a look at this. What this takes advantage of is the EMS Data Center has a really robust series of training modules called toolkits. And so what I've done is I've just crosswalked those toolkits with our training here in Arizona. And so despite its length, it's only 14 slides long, there's a lot of links to click through. If you do it very diligently, you progress forward through the entire course of our data centers toolkit. So taking input, I can take corrections on it now. You guys see anything? That's what all those little and it's sort of a multimedia in terms of some of them are podcasts, and some of them are videos, and some of them are actual small tests. The other motivation was that given that distributive education is still something the paramedics can claim, that you can claim this as a individual study if you'd like to, and cite this as the source of it. Corrections, I'll take them. Or any comments? When you say febrile, it's one of the differentials that we were going to make. Yeah, absolutely, in the training for sure.
So is this currently the completed training then?
I'm sorry.
Well, this is the full training
Yes,
module?
yes.
Okay. Bradley?
Thank you. Quick question. Was the dosing listed for midazolam and the other drugs compared to the Rampart study and our current TTTG? I think that maybe is the only thing I would highlight. I think with the Rampart study that then had kind of updated our state TTTGs, we really focused on the intramuscular dosing.
So I think what Gail was talking about is the slide here related to the pharmacology. So while the preferred management, IM is generally considered the preferred initial route for this, and IO and IV medication given not preferentially. So I didn't know if your training discussed that or.
Yeah, what kind of updates would you like to see on that? Are you talking about striking the IO and IV from the routes, or?
Well, just discussing the fact that the IM is the preferred the preferred route.
Or we can update some verbiage for sure.
And there was another comment about education in here related to febrile teachers. I don't know what's in all the links.
It's included in the training as a differential for the source of the seizure.
In one of the links somewhere.
Right in the slide set. I think if you keep going a little bit further, it'll say, make sure you're not dealing with something else. Or mine?
I don't know. I don't see anything in here about.
Entire slide.
I only see 6 slides here, or 1, 2, 3.
Oh my gosh,
I
I'm
only
sorry,
see 3
Dr. Ray. I'm
slides
looking
here.
at another slide set that we have coming up. I apologize.
Oh, okay.
We talk about febrile temperature in that slide set, so I'm getting that mixed up. Let me include that. I appreciate that pickup.
So this one is 1, 2, 3, 4 slides. 5 slides. Correct, Adam, we're not missing any here.
There should be front and back.
Yeah, I still count a total of 1, 2, 3, 4, 5 slides. Oh, the
14.
5.
Right?
Yes.
Is there any thing indicating concentration of midazolam with regards to like how many milliliters per milligram tested for iron administration? And with 5 milligrams per 5 ml, the patient's given 2 or 3 ml, just 2 or 3. Be getting 2 or 3 milliliters. Five to 1, I think.
5. Number 2, yeah, and 2 ml. Yeah, it's generally a more concentrated version. Okay.
But that's later, people. Yeah. Like right now with all the shortages, you sort of get what you get.
Yeah, that may be a very good point to
yeah.
include in this education, though, is, ideal intramuscular injection should be 1 mil or less. Consider your drug concentration and alternative routes. That would be, there's a really, training, there's lots of great things we can talk about. And from my side, as a medical director, it's great to include a lot more information on febrile seizures. Our providers frequently think it's okay to let people stay at home after a febrile seizure, simply because we don't do anything in the hospital. But we do have courses for those patients. Very important to encourage those parents to get an evaluation. So it's great to see a full slide on when is it safe to stay at home after a seizure, and that type of stuff.
Sure, let's get that revised and I can reach back out. See this. Thank you for that.
Is there anyone from the education committee that would possibly volunteer to help Adam and Paces make the updates?
We have an amendment to add febrile to the. Maybe make that.
Concentrations.
This is Dale. We obviously would encourage any participation, but Chris Ramos and I are happy to take this feedback to Paces and do the updates.
Thank you, Dale.
And I'd be happy to volunteer to look over it as well and provide additional feedback.
So are we wanting to amend it and bring it back, or just amend it?
Yeah. So motion, but what I'm hearing is potentially reviewing this, bringing it back with some. I have a motion for that. Motion to table this and bring back some of the suggested changes. Have a second?
Second.
All right. Thank you guys very much for the work on that. Like I said, Adam, feel free to send that, and I'd be happy to review it with our pediatric folks as well and provide some additional feedback.
Sure.
Yeah. I lost my. I don't know. Did you steal my document? I hope not. I probably lost it. I think I just took a couple more. Oh no, I didn't. I didn't have to hear. Sorry. Oh, that's it. Okay. Also in your packet, we have a standing item here. These are the education training modules. So this is sort of the full list that we keep. Everything that's currently on the website, additional work group ideas, some SDR curriculum needs, and then sort of the dates that we would need additional review of these items so that we keep things as up to date as possible that are currently posted on the website. I think that the other things that we had talked about were continuing work with some of the STR curriculum. We have worked through some of the airway stuff and end-tidal CO2 anaphylaxis, IM medication related stuff. The other things that we have been looking at are IV access and venous blood sampling. So that could be another additional work group. And then some additional ideas for some other trainings, including geriatrics and some Alzheimer's training as well. So if anyone has specific interest in any of these, definitely shoot me an email, and we can begin to work on any of these other modules. That does bring me to another item here, which is discussing forming a work group to create a fall prevention mitigation training. So do you want to speak to this one at all, Shelley?
Let's close out item F. Were there any?
Anyone have anything specific they feel they need to work on in the short term? We could definitely form any additional work groups now.
All right, hearing none, we'll move on.
The next item is forming a work group to create fall prevention mitigation training. I can't remember where this came as a recommendation from, to be honest.
Gail, how's your institutional memory?
Sure. So this came up as a topic in regards to the presentation. I think at the statutory committee meetings at STAB, and then also at TEPI this morning regarding some of the work that's being put together by Arizona Fall Prevention Group, and just looking at our overall morbidity and mortality related to ground level falls and hip fractures, both in our trauma and non-trauma population. And so the thought was to look at forming a work group to create an education on fall prevention and mitigation specific for EMS. There is some of this work that's been done out there for kind of community paramedic programs, but I think there's also work that can also be done just for a general 911 type response. So that's a little bit of the background behind this.
Perfect. Thank you, Gail. Do I have a motion to discuss this action item?
So moved.
Great, thank you. Any specific conversation regarding forming a work group or anyone interested in working on such training? Definitely something we can probably do in partnership with some of the fall prevention folks, and I know that there is some existing training out there related to fall prevention in the EMS space. Probably pull together.
Is the training that was presented this morning, is that, like, without having seen it all, is that robust enough to meet our needs, or would that need to get reviewed and then maybe added on for our purposes?
I think it probably would be something like reviewing some of that existing training. And
I think that training is specific to care facilities. There's, I'm sure, certainly things that EMS would be applicable, but I think probably more EMS focused. A lot of it's work that's done currently on kind of a normal 911 call when crew's gone, just a typical fall injury or lift assist type call where there's identified issues of what maybe caused the patient to fall, like a throw rug next to the bed, discussing, hey, can we move this rug out the way so you don't fall again? Some basic interventions like that. So there's definitely some good information out there that's more EMS specific.
motion to form a work group to work on this training. Also something that we could consider putting on our list, our work group list, to continue to think about and pull up in the time when there is forming a work group. I'm not going to work with anyone that's willing to jump on this. Motion from Jason to put this on our education work group ideas list. Those in favor, say aye.
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 Thanks very much. The next action item is to discuss, amend, and approve forming a work group to review the bylaws. We save the best for last. And would like to motion to discuss this item. Thank you. If there is anybody who is willing to join me in reviewing the bylaws, this is generally a fairly quick process. Sometimes there are maybe one or two things that we address in the bylaws on any given go around. So it shouldn't be a lengthy process. And I would love to have anybody who'd be willing to help. Okay, so can I get a motion to form a work group? Okay. All those in favor, say aye.
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 Okay, perfect. around some dates, we can have a meeting, send it out ahead of time, so everyone can have some time to look over and review the bylaws. Next on the agenda, any agenda items needed to be considered for the next meeting? Does anyone have anything specific? And if not, if something comes to mind, feel free to email Shelley if something comes up that you wish to be included on the agenda for the next meeting. I'll move on to call to the public. Public announcements, public information. Hearing none, you can review in your packet here the upcoming educational events. There's several on here throughout the summer, so feel free to take a look at those. Some of our sort of annual trauma conferences are coming up, and those events across the state. So hopefully we'll see you guys at some of those. Also, these informational things are posted on the Bureau page as well. Our next meeting will be July 20th at 10:30, and hearing nothing else, we will adjourn the meeting. Thank you all.
Thank you, everyone.
Thank you.